I'm going to introduce first Ashley Hines. Ashley is the Executive Director of the Benton Harbor Community Development Corporation. She's a project manager, change agent, community visionary with a passion for innovative system building and advocacy of Black communities. I don't think I need to read all of this. All right, okay. In November 2020, Ashley founded the Benton Harbor Community Development Corporation. The corporation's mission is to strengthen the community of Benton Harbor socioeconomically, mentally, and physically by supporting and empowering residents through community development projects and programming. Its holistic approach to community building is guided by innovation, equity, and collaboration. She has dedicated her time and talent to advancing the work of organizations committed to entrepreneurship, small business development, food sovereignty, and education. We do a lot. Ashley currently sits on the board of ZOY Adventures and the Harbor Impact Foundation. Whether it's curating experiences that center Black people or striving to work with communities to build systems against systemic racism, Ashley's work continues to be a love letter to Black people, honoring, highlighting, and preserving Black culture and community. So, Ashley Hines. Next, we have Mike Keene. Mike is a managing partner of Hometown Development, LLC. Mike currently leads the development of Portage Midtown in South Bend, Indiana, and is the president of the Bakery Group, LLC. He is also the facilitator of the Michiana Town Makers, an ecosystem, an informal network of small-scale developers, design professionals, finance officers, real estate agents, property managers, contractors, neighbors, and municipal officials dedicated to creating wealth in communities, wealth in neighborhoods for neighborhoods. In 2008, Mike founded the Indiana University South Bend Center for a Sustainable Future and led the development of the first BA in Sustainable Studies in Indiana. With 2 decades of experience of a sustainability professional, he has a lead AP. He has his lead AP. Did I say that correctly? And 30 years of experience as a professor at Indiana University South Bend. Mike offers sustainability and small-scale development seminars, workshops, and consulting services to developers, municipalities, and not-for-profits wishing to integrate sustainability and incremental development into their products, service, and communities. Welcome, Mike. Next, we have Ryan Kilpatrick. Ryan is lead consulting at Housing Next. With an extensive background in economic development, community design, and public finance, Ryan is the lead consultant for Housing Next. He has helped to define access to housing as a core economic development issue for West Michigan through data-oriented dialogue and partnerships with employers, local municipalities, chambers of commerce, and developers. Prior to leading Housing Next, Ryan worked for the Michigan Economic Development Corporation, where he was lead project manager for West Michigan. Ryan has 16 years of experience supporting local units of government with technical experience and best practice implementation through planning, zoning, process improvement, and the use of financial tools to create economically vibrant communities. Welcome, Ryan. And Tiana Williams, equitable housing advocate. Born and raised in Muskegon, equitable housing advocate Tiana Williams experienced the highs and lows of the housing continuum. After several years of renting and relying on public assistance, Tiana's family was able to purchase their first home when she was 8 years old. In the decade following, they acquired 13 additional homes that housed other families in the community. Her parents provided stipends to tenants for utilities, reduced rent when needed, helped families realize home ownership and navigate the housing terrain. The display of dignity, respect, equity, and justice that her parents demonstrated inspired and motivated her to help others. The challenges and triumphs she faced through her housing journey incited the desire and curiosity to pursue a career dedicated to dismantling systems of inequity. Tiana hopes to partner with others to develop policies that will create healthy conditions for all members of society to have a place to call home. Tiana is the owner of Collective Awakening, LLC, a consulting company. Welcome, Tiana.
Well, I am excited to be in conversation with you all so people can hear solutions that I can't give. But what I like to do with panels like this is to hear people's origin stories and what led them to this work. So Tiana, we already heard a little bit from you, but if you could talk some more about, and each of you, like your upbringing, what led you to the path to doing the work that you're on.
Thank you. Can you hear me fine? Okay. I am, in addition to the housing advocate, I recently, I'm former Continuum of Care Associate Director for Kalamazoo County, so addressing homelessness from a systemic level. I just in my bio, my family were recipients of welfare. When I was 2 years old, we moved into our first home that my mother was able to purchase due to a payout for some Social Security benefits during the death of her father, which happened when she was 3. And so she actually told us about the start of housing in our lives as a family when we had a landlord, Mr. McKinney, in Muskegon Heights, Michigan. My mother and my father couldn't afford their rent. And instead of evicting them, he began to take off how much they owed, right? That's crazy. And so at 8 years old, my family purchased our first rental home. And so we call it Big Beauty. It was not a beauty. It was really dusty, actually. But in that, my mother and my father began to teach my 8 siblings and I how to fix houses, right, and renovate them, put that sweat equity in there. And so over the years, I've seen my family introduce home ownership to others within the community of Muskegon County. And so as life happens, right? My mother always told me the higher you go up, the more humble you become, because life will happen. In 2012, our family home was a part of the illegal foreclosures that happened across the country, which there was a class action lawsuit that recently happened with that. And so my family being on the highs and the lows there, right? We ended up being illegally evicted in 2017, a few weeks before my birthday. At that time, I was facing a housing crisis. My parents had helped me purchase my home in Kalamazoo County when I went to Western Michigan University in 2010. As I was a college student and working, making minimum wage, barely able to pay regular bills, I fell behind in my property taxes. So while my parents were facing their housing crisis, I was facing my housing crisis. And in my work, sometimes we're driven by our personal experiences. During that time, I had the opportunity to work for a company called Community Encompass in Muskegon with the eviction prevention program. When I got there, it was failing and it was kind of stressful. But in about 7 months working with program participants and city officials, Community Foundation in Muskegon, and other nonprofits, was able to turn that program around, so much so that it captured the attention of the Michigan Supreme Court just before the pandemic started in 2020. And so a lot of life experiences on the highs and the lows really fuel my desire to take part in this work.
Thank you. Ryan?
Sorry.
We'll just go down the line for
Okay.
this one.
I appreciate that you asked this question because I don't normally connect the dots between how I grew up and what I'm doing now. So thank you for asking the question. I want to give credit to a woman named Deborah Snow, who was a teacher of mine in high school. And some of the work that we did in this program that was called We the People was designed to understand the Bill of Rights and then defend certain elements of the Bill of Rights to a panel of judges. And that program allowed us to go compete at the state level and the national level. And I was assigned the 13th and 14th Amendments. And really, I learned the content, but didn't understand the impact that those amendments would have on my career trajectory for the last 20 years. And so I learned about racial segregation, and I learned about Plessy v. Ferguson and Brown v. Board of Ed, and had to go speak articulately about those things to people who were really intimidating. And from there, I went to college and thought I was going to study marketing and just didn't get into it. And I studied urban planning and loved it. And went from a planner to economic development to running a housing advocacy organization. And with each of those steps, I've really dug deeper into the work to understand the systemic and structural components that we're all faced with, and the generational work that we have to do going forward. And frankly, if it wasn't for Deb Snow, my high school teacher, really pushing us, I probably wouldn't be doing this work, or I probably wouldn't understand it the way that I do.
Well, thank you.
I grew up in a family of a college professor and a not-for-profit healthcare administrator who ran a community health system in Northwest Ohio. And I grew up wanting to change the world. Got my PhD in sociology, and fundamentally thought that we needed to have major and systematic social economic change because our system wasn't working. And thought I was not going to be a college professor because I didn't want to do all the publication stuff, and I was going to be an activist. But after a couple of years getting paid 28 hours so that they wouldn't have to pay me health care, I decided that maybe I'll switch that around and become a full-time professor and do activism on the side. And I did that for about 30 years, and I got to the point where I was now in a position where I could walk away from the university and start to do more of the kind of activist stuff I was doing. And what I was really interested in was bringing together social change, social equity, and environmentalism. And so I got involved in the sustainability movement. During that process, I met a guy who could produce homes and produce as much energy as they use for the same price as stick built. And so I said, well, let's build one of these houses as an example in my neighborhood. That was 6 years ago. That morphed into some mission change and became a $15 million, a 15-year project. We're in year 6. And part of it is paying it forward to help teach other folks how to create wealth in underserved neighborhoods for those neighborhoods by basically helping the people who are there do it. And in some sense, this is just back to the future. This is the way our neighborhoods were originally created. And it's the only way we're going to keep people from coming from the outside and screwing it up or owning it is if we help the folks that are already there be the ones that build them back.
Yeah. Hi, everyone. So I too appreciate this question because I don't know if I've ever thought about it to this capacity, but I would say I ended up on this journey because I kind of fell into it, right? So I'm born and raised in Benton Harbor, Tiger Pride. And in 2006, I moved to Baltimore for college, and that is where I have lived for the past almost 16 years. And so being a first generation college student, particularly one from Benton Harbor, I think that there is this notion that in order to do well, you have to lead the community. And so a lot of people, they lead this community and become disconnected, so to speak, right? And so here I am in Baltimore, living my life, growing my career, really just checking those boxes. And in the process of checking those boxes, obviously home ownership is one of those things that you seek. And in that journey for me, there were a lot of resources that were available to me as a first-time home buyer, not just financial resources and incentives for me to purchase in the city of Baltimore, but also the education behind what it would take to be a successful homeowner. And so in looking at that, I've always wanted to bring that education to my community, the one that I love and grew up to be a part of. You know, my family and friends were still very much here. And so, you know, coming back to Benton Harbor to visit, you see a lot of the, you know, revitalization that you talked about happening where, you know, you see downtown development and all of these great amenities popping up, but a lot of it was not happening in the inner city communities. And so for me, I wanted to ensure that Benton Harbor Legacy residents had equity and ownership of the transformation that was happening in this community. And so that is what led me back to this journey. So I quit my job and I moved back home to do this work. And, you know, at one point, very early on in my career, someone said to me, like, first you learn, then you earn, and then you return. And then, and that is, and that is why I'm here, to be able to pour back into this community, because as we know, you know, all neighborhoods deserve all these great amenities, but if we're not working the other end of the spectrum and helping people, displacement is what's going to happen over time if we're not taking an intentional look at it. So.
I'm eager to learn more about what your development corporation is doing in the work and where we are right now. But I want to get one very important question out the way, and that is, what can a hospital system do around these housing issues? Because this is what this hospital is thinking about, is what's, you know, came up in my questions. I said that I am not equipped. I can give examples of some things that have happened in Chicago, but what advice or what steps would you tell the system to do?
So I guess
and we can just go back down the line that way.
Yeah, I'll start with this because from my perspective, as someone who is doing work in this community, Corwell, the new name, I was just telling someone a couple of days ago that I really appreciate the intentional focus that you all have in wanting to have change, but ensuring that you're doing it from an equitable standpoint. And so I commend you on all of the work that you're doing in that arena. So thank you for that. But regarding housing, for me, I know that there are a lot of grassroots organizations that are boots on the ground doing this work. And so one of the things that you could easily do is figure out how you can partner with these organizations who are already working in the community. How can you support and help to build their capacity with the resources that you have? Because, you know, we're not necessarily expecting a hospital system to completely fix housing. You know, that is not necessarily your lane, but how do we build this ecosystem around how housing is addressed in this community? And then another thing that I'll add to that I always advocate for is, you know, take care of your people. That is something that is, you know, tried and true, and it's not something that is that doesn't happen in other communities. You know, take care of your household. So how are you incentivizing employees that already work for you and encouraging them and helping them to build equity in their home ownership journey, which would then benefit this community? A lot of times we see push around bringing employers in, but you already have employers that work in this community, that live in this community, and that are valuable contributors to that and to these communities. So how can you support them in helping to build the economy, create stable and safe neighborhoods? And so you can easily do that by offering down payment assistance, closing cost assistance to people who you employ.
I think that one of the things the hospital can do is to be a convener and a champion. We currently have in South Bend, Indiana, where I come from, we have a group of about 220 people who are in an ecosystem trying to bring about small scale development, housing, single family, multifamily, renter, owner occupied, as well as re-energize the commercial nodes that much of this housing was built about and has been left behind. In order to make that happen, what we need to do is bring together the folks who are going to do some of the developmental work, people like me who didn't know how to do a spreadsheet 6 years ago and just kind of fell into this by accident. But also we need to have the municipality put together. You've got to do certain things about your zoning codes and your building codes and stuff like that. Need to activate the not-for-profit company, community, the neighborhood organizations, churches, any colleges and universities that might be around. And then you need to connect to the financial community to make sure that you get some finance place in there. What we found is that core to doing that is a champion that begins to bring those folks together so that they can begin to have these conversations and that make sure that everybody's at the table from the beginning. And what that means is really not us. We need to be there, but it's the folks who are going to be in the community doing the work. And if the hospital can do that, become that champion, it can make a huge difference in beginning to get that ecosystem going and creating what we call a flywheel effect, which you start slow and you start small, but over time that builds and that grows and it becomes self-replicating and self-directing.
I mean, there's not a whole lot to add here, right? So yeah, maybe to put a slightly finer point on some of these items, making investments through a CDFI, I heard you mention that earlier. Community development finance institutions are great financial partners who can then invest in your nonprofits and invest in small scale developers. And sometimes it needs a lead convener and a lead investor to be the instigator of those kinds of things in a community. But I think Mike's point about having a local champion, that doesn't have to be the hospital. I think having somebody who's got knowledge of the community on the ground and knows all of those parts and pieces and can help to bring them together with the social capital that the hospital brings, I think that can be really transformative. So really thinking about who are the people in your community that you can be investing in and how do you create the infrastructure for change?
I agree. And just taking back from what Ashley was saying about partnering with grassroots organizations or organizations that are already involved in housing. As I shared in my work in Kalamazoo as the Continuum Care Associate Director, we had hospitals that were involved in that work. So the Continuum acted as a convener to address those housing systems and inequities. And one of the things that came up was frequent users of the ER, right? One of the things in the community, in the Kalamazoo community, we see it tends to be those with lower incomes who are unhoused or may have just exited a correctional institution and may not have anywhere to go. And so one of the ideas that was toying around was there a respite house, right? Someone that may need to sleep it off, may come in the ER drunk and need a place to stay. And so investing in respite houses and when we also talk about that social influence, right? And we talk about those that may work for the hospital, there are influencers of health there taking an investment in looking at the lowest paid employee. What are some of the gaps that they may have in their lives and then invest in that. A few years back in Muskegon, I was a part of the 100-Day Challenge. It was called the Shire, so the Community Health Innovation Region Challenge. And one of the things that came up was transportation to work for factory workers. A lot of the factories in Muskegon have left, and so you have to travel to Grand Haven. And so an idea came about was having those the factories invest in the transportation so that they can get their employees to come to work, right? And they help to reduce the turnover rate going through temporary agencies. And then, and people have reliable transportation. So just thinking about how to really enrich the lives of those that are employed by the hospital, as well as those that are being served in other areas.
Partnerships. Partnerships are key to how so many communities get things done. What are some pitfalls that need to be avoided by good intentioned people or institutions as partnerships forge? And start with you, Ryan.
Housing Next, the organization that I've been representing for the last 5 years, is a great example of a partnership. It's supported by our local chambers of commerce, our community foundations, our county administrator, our economic development organization, and an alliance of other nonprofits. And in a lot of ways, it's been super valuable. But what we also get is the particular lenses of each of those organizations showing up at the board table. And so when we're making decisions, it's our business community who has a voice at the table, who's able to really put a thumb on the scale around wages, right? As we start to think about what are the underlying causes of housing scarcity and affordability, a decline in wages relative to cost of living is a big issue. But we're hesitant to have that conversation with certain folks in the room. And we're hesitant to have other conversations based on the lens of particular folks who are at the table.
So Ryan, I'm going to ask you to be very specific in what you mean. You don't have to say people's names, but what, as we're trying to think about barriers and who's stymieing, like, why don't you want these people in the room, and who, again, not naming them, but what is this lens that you're referring to?
Yeah. Okay.
I'm a journalist, as Ashley pointed out.
I appreciate it. It's good. So we have a broad diversity of business owners who are represented in the community with a broad diversity of perspectives. And I think the leadership of our business advocacy organizations doesn't want to get crossways with anybody on that spectrum of business owners. And that ranges from businesses who say, we don't pay our employees anything less than $75,000 a year. From the guy sweeping the floors to the coders and the engineers to the CFO, nobody makes less than $75K and the business runs great, right? And so we're like, awesome, let's do more of that. But we've also got business owners who are like, hey, we're getting the cheaper we can get so we can produce products as inexpensively as possible so that we can sell as much as possible. Which is an important lens, but it also is having impacts across our community. And it's creating ripple effects that make it harder for us to solve the housing conundrum because we don't have enough people who earn a wage that allows them to afford housing in the community. And so while our partnership is really important with the business community because it gets me in the door in a lot of places, it also makes it really difficult to talk about the issue of wages and how it impacts housing affordability. Because the reason I got in the door is because that community doesn't want to have that tough conversation about wages. And I'm not trying to say that there is a particular solution, that there is I'm not advocating for a standard living wage at any price level, but the acknowledgement that wage is a critical factor in housing affordability really needs to be part of the conversation. And because of our partnership, in some instances, it makes it harder to talk about.
And just to follow up to that, your work is in Western Michigan, which is what communities, like how broad is Western Michigan in this context?
So Housing Next was started representing solely Ottawa County, which is Holland, Grand Haven. We now also represent Kent County and are doing some work in Allegan and having conversations in Muskegon. So growing influence incrementally.
Okay. Anyone else want to weigh in on partnerships?
I do. So the only thing that I would add to that, well, a couple things as it relates to Think So Boy. I think that as you come to the table, it really is important to be mission centered and really focusing on what the goal is, right? So, and to do that from an equitable standpoint, because I know that there are times where especially at the beginning of doing this work, there are a lot of things that are important to build a thriving community, right? But how do you stay mission centered in this approach? So as we talk about housing, my thing is affordable homeownership. And then you may have someone else who say, no, in order to build this city, we need market rate housing. I'm like, no. But how do you create this space and do that in a way in which, we grow this economy, but still working on both ends of the spectrum and doing it in the synchronized way. So staying mission centered in that, and then also ensuring that the community is at the table. There are a lot of times where I'm in rooms where there are people who are making decisions about this city, and they don't even live in the city, right? So our communities are being shaped by people who, not to mention they don't live in the community, but they don't even live in the city of Benton Harbor. And so as we, I'm seeing more so this prescription approach to how we create community, as opposed to diagnosing and reaching out to the people who are already in these communities to make those decisions. So
I'd like to share something about partnership from a collective effort in reducing homelessness in Kalamazoo. Something that I noticed was interesting. You all touched on a little bit about agencies or other businesses coming with their mission first and centered, right? And so having been in that room, in those rooms, you kind of just sit back and you're like a fly on a wall. And you're like, what's really happening here? What's the underlying? You usually have someone who's more vocal, and you have someone that's quiet. And so one of the things in what I called, what was called the Outreach Coordination Work Group in Kalamazoo County Continuum Care, which addresses homelessness, which serves HUD Category 1 homelessness for unsheltered. As I stepped back and I looked at the governance and the way in which we would operate. And so I looked at the power structure and the dynamics there. And so as the associate director, I had the ability to recognize what do I have in my wheelhouse that can influence the dynamics here to share power. And so in the governance structure, operated from a consensus model. And so with that, we had the layer of the committees, the members, which are different organizations. We had the COC representative for that group. Then we had the Continuum of Care staff, and then I layered to the board. And so when decisions came, started with those who would be most impacted. Right? They have to be at the table. We talk about an example is law enforcement with homelessness. And so any decision that would have involved law enforcement with this vulnerable population had to have the voice and the needs of those who would be most impacted there as well. And so by spreading and distributing that power, so it's not unilateral, it began to open up the dynamics for a community to really begin to address the mission that we have for that group. And so in partnerships, I'm looking at when we come together, what are our shared values? How do we share that power and how are we intentional about that? Other than that, we have that uneven distribution of voices and those unspoken things that need to be said. So it's almost like the facilitator empowering all members of the group to be able to share, whatever that looks like.
And the only thing I would add is that partnerships are about building relationships. And so that's part of what that is. But it's also about getting things done. And so what I would suggest is that people need to avoid planitis. The more partners you get, the more people want to sit around and plan. And often nothing gets done. So number one, not everybody has to be at the table. Find the people who want to do something, because you know what? If you do something that happens, people start coming around. And then so plan, but also do at the same time. Because relationships are built not through planning, they're built for doing. And so, if you got a vacant lot somewhere and you think, gosh, we need to have a house there someday. Well, you know what? Next week, let's get out there and put a garden box on that thing. That's our do. And then let's plan.
I want to talk to you all about some of the housing wins that you're most proud of. Ashley?
Okay. So the first thing that comes to mind as far as housing wins is just being able to have an option for people to receive home buying education in this community. For me, I realized throughout my journey that one of the biggest barriers to homeownership is the education behind the process, and the fact that for a lot of people, it can be obtainable. And so having that in our community and being able to see people be successful at accomplishing their goals. And in addition to our class, we have a one-on-one counseling program where we're able to, help them build their plan of action to obtaining home ownership. And so for me, those are those small wins. When people come to our class and, a month later, they're like, I bought a house because of your class. Like I didn't know I could buy a home until attending that class. And so being able to get that information out and empower people in that way so that they not only make that decision, but they're able to make educated decisions about the process.
What are you finding that people need the most help with?
Money, first of all.
Okay.
The financial barriers, because, a lot of people, they are able to make the monthly payments, things of that nature, but it is, a lot of the costs that people don't talk about that are associated with home ownership, like the inspection costs, the appraisal fees, closing. A lot of people talk about down payment, but then closing costs is something completely different. So those fees add up. And, there are some programs where you're able to roll some of those things into your loan. But that is what I'm seeing is one of the biggest barriers is financial programs in order to help people get over that hump. Because, like I said, they can make the monthly payment, but they can't necessarily those upfront costs. And then in addition to that, credit, that is one of the common things that we see as well.
Mike?
I would think the thing I'm most proud of is a relationship I developed with something called the Near Northwest Neighborhood in South Bend, the organization there. And the neighborhood I work in is right in the middle of that. And if you know South Bend and you know what's happened south of Notre Dame, that has been a gentrification like you wouldn't believe. It would have been more honest if they just would have taken some bulldozers and gone down to 23, because it was like 15 years. And I love Notre Dame. I got my PhD there and I worked with them. But I really think that, this is something that I don't think they intended it, but they didn't pay attention to it. Well, the neighborhood I'm working in will never be Notre Dame. But if we were one half of Notre Dame, then our houses would cost $500,000 and not $750,000. And right now, over the last 5 or 6 years, they've gone from about 90,000 to 160. So what we did is, as I had told you, I had picked up a number of lots that were vacant in there. So I took what actually are probably my two most valuable lots, and I sold them for 10% above my cost to the Near Northwest Neighborhood. One of them, that means I sold to them for $880. But there was a proviso, and the proviso was I would only sell it to them if this CDC would agree to not build and sell, which is what they typically do, single family, but would build multifamily and then hold on to it and rent it out. Because what that would mean is that right now, in 15 years, what will happen is that those prices go back to market rate. And we have had very successful NNN. So in the last 20 years, they've redone 100 houses. They're starting to go to market rate. And now what's happening is the people those houses were built for could not afford to buy them now, which is a beautiful thing for the families that were in them, because that's a one-time thing that affects their trajectory forever. But over time, 30 years, a slow motion displacement will occur in our neighborhood. But by getting them to put a fourplex and a duplex and rent it out as affordable, I now have 6 units, probably the 36 we'll build in the next 5 or 6 years, that will be affordable income qualified forever. So starting to hedge against the challenge of gentrification and assuring that we're going to have mixed income neighborhoods from the beginning by looking at alternative economic structures to do some of our home ownership is that. And that was one of the easiest ones we could do.
I wish I had the same bias toward action that Mike does. When I started in my role at Housing Next, people were calling me a housing expert, and I really didn't have a lot of background in housing. I was a planner, an economic developer. I understood zoning, and I understood kind of all of our financial tools in the ecosystem. And we had people who were saying, gosh, we need all these housing units, but it was all anecdotal. And so the first thing that we did is we conducted a housing needs assessment to really understand how much housing do we need, at what price points do we need it, in what neighborhoods is it necessary. And that housing needs assessment really gave us a playbook to then go community by community to talk about what the needs were, how that correlated to our business growth, how it correlated to folks who were already in the community and cost overburdened. And little by little, what we were able to do is amend 7 zoning codes, update 5 master plans, we discovered that there hadn't been a family-oriented tax credit project built in more than 20 years in the entire county. And since we've been able to get more than 1,000 units under construction using the tax credit program, just by making sure that people understood the data and understood that they had control over what got built in their community and could influence those plans and policies.
I have several favorite stories, but I think at the core of each of them, what I'm most proud of in this work that I've done in housing is making room at the table. And I was thinking about recently, Kalamazoo County released the housing study that the Upjohn Institute was commissioned to do, which would use some millage dollars that was passed in 2020 to build housing for residents of the county. As like many of your communities, we have a housing crisis and everyone has a solution. But in that space, as the associate director for the Continuum, I had the opportunity to partner with Upjohn. And as we were working together, being one of the partners at the table, we noticed that unhoused voice was missing, right? And so, of course, you have a bottom line, you have a budget, and you're like, okay, they're gonna do a survey method, they're gonna do some stuff on Facebook, but it's still like, I serve on my neighborhood association, and you're like, there are still people who are unhoused, who may not have the ability to inform the survey. And so my teammates and I came together in partnership with Upjohn and created a survey that would be tailored for unhoused residents that would be complementary to the one that would go out to the general public. And so we looked at our listserv and our resources, and we said, well, how are we going to disseminate this survey now that we have this wonderful survey in place? And so we had undergone strategic planning and failed epically at getting some lived experience there, our methods there, but we learned from that. And so we decided who our target population was, right? So it's going to be category 1 homeless, HUD's category 1 homelessness definition. And so we looked at our membership and we looked at the agencies that had that serve that target population. Then we took a step further. We said we don't want to exclude other agencies that might have association with our target. And so we sent out a mass invitation to help us disseminate these surveys to the listserv, and then also did some targeted approaches there. And one of the things that we advocated for was compensation to those who would be taking the survey. And we were a team of 2 at that time. And so, but it was so important that we would rally other folks to help us make sure that we train providers to disseminate the survey, and that we would make sure that participants had their compensation at the time that they took that survey. And so we were able to get 169 responses. Now that might sound like a small number, but we set the bar at 50 because we couldn't even get one to do a survey before. And so what that did though was really shed light and put it in the face of every single person, nonprofit, advocate, city official, county official, that this is the problem here. And this is what people are saying that they need to be successful in their housing journey. And so now we will have to look at that at every decision that we make. And we'll have to grapple with whether or not we listened to what people told us they needed, or we went in another direction. So for me, my favorite, or the greatest housing impact, is scooting over and making room at the table for folks to be able to advocate for themselves, and then providing tools for them to be able to do that.
Ryan, as you were talking about who you may not want in the room all the time when you're talking about housing issues, it made me think about something I reported on in the Chicago area. And there's a suburb called Deerfield, which is where Walgreens is based. The median income is 6 figures. It's one of the whitest suburbs in the region, and they tried to keep out, well, they kept out African Americans, in the early 1960s. And so a pastor reached out to me and said, we have this land next to the church, and we want to build affordable housing. Well, the communities use euphemisms now, like, what about traffic? The schools are going to be overcrowded. All things that aren't true. And it went before the city council and it failed. And I interviewed the mayor and, talked about the history of Deerfield and the lack of affordability for even teachers to live in a community like this. And so the church went back and changed its language, and they started calling it workforce housing instead of affordable housing. And on the North Shore, which are the expensive lakefront suburbs, there was a housing group that was called, it had affordable housing in its name, and they changed their name to Open Communities. Because people like open space, and they got some wins there because it's like they turned into an environmental issue when it was really a housing issue. And when Deerfield called this workforce housing, it passed. And I wonder, in your work, as you face barrier, the NIMBYs, if you are, I'm assuming that everyone has faced NIMBYs, how do you either think about language or shift your message to get people on board?
I guess I'll start. Okay. Because that is something that I feel like I'm actively dealing with, because for me, I don't feel like I code switch, right? And so even though I'm not necessarily radical as some people in my approach, I'm very clear about the work that I do is for the people who live here, which is predominantly Black people. And so in a lot of rooms that makes people uncomfortable, but so for me, I haven't adjusted yet. And it has not seemed to affect our work because the work speaks for itself. And so that is kind of how I've combated that is, you can't argue with results. And so if we are ever faced with that, I hope we don't have to come to, that point. But for me, I think that for a lot of people, my approach is too Black. I've heard that, I heard that she's whatever, a lot of different things, right? And I'm sure some people in this room have heard those things. And it does not mean that I only work with Black people. No, I center Black people in my work, and I'm willing to work with anyone in order to do that. And so I think that is part about what we talked about, remaining mission centered and the things that we are doing, because this is a predominantly Black community. And there are times where I'm also on the phone with people who are of different races, white, whatever, who will say to me, we want to ensure equity for Black people because of disenfranchisement. And so these are the people that I choose to connect with, because I need you to be able to say it boldly if you're going to be at the table with me. And so that's kind of how I have handled that so far.
We've had to deal with the term affordability in a slightly different way. My partner and my goal is a small one. We want to change how America builds. And we want to create the most affordable house in America. But in doing that, what we wanted to do is redefine affordability, because what we found is that if you value engineer a house to be affordable, you actually might be costing the person who's got it over the life cycle much more than it would cost to get in it. What I mean by that is if you put somebody in a house with 2x4 walls, cheap insulation, windows that are made out of vinyl, they're going to go away and need to be replaced in 12 years, and a roof that's going to have to be replaced in 15 or 17. So they can get in that house that's so-called affordable. What you've done is you've put a time bomb around their neck. And just about the time they get to 15 to 17 years and start to get equity, they have to take out a home equity loan in order, and they're right back. So we build houses that are meant to reduce your energy costs at least 50% to 70% and have no major maintenance for the first 30 years of a mortgage. And what we're trying to do is get places like Habitat and our CDCs to redefine affordability as across the life cycle so we can begin to talk about those kinds of issues. And quite frankly, the upfront price does not have to be much more than standard. You trade your basement out for an increase of metal roof, decent siding in your windows, and you can build the same house without the basement, but give that upgrade.
We try to have pretty consistent messaging, but we definitely had to think about what that message was, because when you walk into a room in suburban and rural communities and you say, we really want to build affordable housing and it's just a block away from you or it's 2 doors down, people immediately ask for the traffic study and want to know how many kids are going to be in the school district and do we have enough, like there's lots of great excuses people find to oppose the project. And so the first thing that we always do is define what we mean by affordable. And so the beginning of every presentation I give, we talk about affordability being not more than 30% of your income being spent on housing. And then we provide a scale. So, you know, if you're earning $24,000 a year, that means you can afford about $650 a month. But if you're earning $55,000 a year, you can afford closer to $1,000 a month. And then we really try to bring in the Planning Commission to that conversation and ask them how many of them are actually spending 30% of their income on housing. And most planning commissioners are older. A majority in suburban communities are white. They typically have had salaried positions for a long time, and most of them are spending well under 20% of their income on housing. And so when we start to propose that somebody making $12 an hour should have to spend $1,300 a month on an apartment, on a 1-bedroom apartment, then we start to get some resonance. Like people begin to understand, oh, now I see what you're talking about. But then we've always got to take it a step further, because typically people assume, and I think this is based on the systems and structures that we built since the 1950s, people assume that density means crime, that density means traffic, that density means lower property values. And so if we're going to build an apartment building in a neighborhood that has historically been smaller format, single family or missing middle housing typologies, they're afraid that it's going to drag down the neighborhood. And so we really have to get into the research. And we've got to talk about, first we have to show pretty pictures, right? A pretty picture is always worth way more than 10 minutes of me talking. But then we've got to dig into the literature, which shows that mixed income neighborhoods did better through the recession and have done better since 2010. When you've got a diversity of housing types and price points in a neighborhood, it allows people to graduate up or step down throughout their life cycle, so that when I first graduate from high school or college, I've got a small apartment that I can live in. Even though I can barely afford it, I can live in the neighborhood I want to be in. But eventually I can move up into a townhouse, and then maybe eventually into a single family home. And then when my kids move out, we can move back down into the townhouse or back down into the condo. And making sure that we've got that life cycle of opportunities in every neighborhood. Those are the things that start to resonate for people as they think about, oh yeah, you know, my kids recently graduated from college and they wanted to move back home, but they can't afford it. We have to connect the dots for people, because when we just talk about affordability, it's somebody else, right? It's a third party and it's often a boogeyman. And so we've got to humanize the folks that are in need of housing in our community. And oftentimes it's our own adult children.
Natalie, before you asked the question, when you asked the question, opened up, as you were speaking, I wrote down power of language and perception, right? And Ashley, you talked about how knowing what your mission is and not steering from that. And I think about this as I wade through life and you know, called to different things in my purpose. What what is my message, right? And for me, I think about what is just, what is equitable, and who are all the stakeholders at the table. This is where I operate from. What is it that you need? Where's the mutuality here? How is it going to impact others around? What are the historical implications that might be associated with what you need? And what will be just out of that? And so throughout my work, it's interesting enough how you have different belief systems and you have different perceptions, right? And recently I participated in the Michigan Campaign to End Homelessness COC Equity Results team framework. And we talked about the historical policies that shaped housing. And one of the things that became so apparent to me was thoughts and beliefs and patterns of behavior, right? I was like, okay, this is happening over and over again. And we talked about the race riot. You talked about the race riot. And I went to the Saab Museum in Chicago last year for Juneteenth. And as I was walking through the museum, I cried. I just started crying. And the person I was with was like, you know, what's wrong? It was really heavy. And it was with a group of people. And I said, I am fighting the same housing injustice. I'm walking through I'm the living legacy of this right now. And I said, we have to do something different. Someone talked about gentrification earlier. I've been wrestling with this thought driving back from Toledo one day, listening to How to Kill a City. And I was like, one of the things that cities are looking for, of course, they have to get revenue because, you know, federal cuts, budget cuts, state cuts. And so often those with the lowest rate of return are Black and brown and poor people, and they're displaced. And so I said, well, in the Upjohn housing study, housing plan, I had the opportunity to inform on one of the thoughts that I had. I said, one of the things that Kalamazoo talks about is the Foundation for Excellence, which I was a recipient of some funds from my back taxes, was how this Foundation for Excellence donates a lot to the city of Kalamazoo and helps with a lot of tax foreclosures. And so I was looking at development and I said, what if we, you have tax freezes and things like that and rebates, but I said, what if we did a radical model of a sliding fee scale? Is anyone familiar with sliding fee scale? So if you go to a health center, you may have, it goes according to your income if you don't have insurance. I said, what if we did that? I know it's radical, without hindering the equity that a household can cash in on their house if they decide to move out that neighborhood and use some of those Foundation for Excellence dollars to make up the cost of what the actual tax would be. And so I just said, we just have to start. We have to start looking at things through a critical consciousness awareness, right? Because our historical policies are living legacies today and will continue to show up with those same patterns and behaviors of thinking. And so I'll leave you with this. In my work, I was thinking about, I said, a person's liberation should not be tied to where I am in my awareness journey. So every table that I'm sitting at, I'm like, what is just right here? And how do we get to what's just for each person sitting at this table or not sitting at this table?